Good morning, and it's a pleasure to be part of this very nice webinar that you are conducting. Thank you, Dr. Abha, for the kind invitation. And so I think can I share my screen and
Right, sir. Yeah, sure, sir.
presentation?
Huh?
Sure, sir.
Yeah.
गरम गरी था नहीं है ना जान
So is my screen visible?
Yeah, sir, it's loading.
Yeah.
Yeah, we can see it, sir. Please go ahead.
Yeah. Okay. So, I mean, what the theme today is that creating awareness on COVID-19, promoting COVID-appropriate behavior, and removing vaccine hesitancy. And I think, as Rajesh Bhushanji very nicely said, that test, track, treat. The other two components were vaccinate and this COVID-appropriate behavior. I think, thankfully, it's on the wane so that the test, track, and treat. Thankfully, we are not needing to treat so many patients of COVID. And I think, as they say, that prevention is the best option, and prevention is far better than cure. So I think we have to now dwell mainly, and my talk will be mainly talking about the COVID appropriate behavior and vaccine hesitancy. Mm-hmm. And in this regard, the community radio station, as Abhaji very nicely said, that it is for the people, by the people. I mean, it is of the people, by the people, and for the people. So I think community radio stations have a very significant role to create awareness about COVID-19 by providing the useful information from reliable source, as Rajesh Bhushanji talked about, or we have a lot of interviews with experts like Dr. Guleria. And so I think the right message should reach the population so that they are able to take a well-informed, wise decision as regards COVID care, as regards COVID appropriate behavior, and which vaccine to take and how to go about it. Mm-hmm. And I think that number 2 and 3 are the important aspects that I'll be restricting to. And of course, the community radio also has a role to play in advancing people's involvement so that they can create in that region kind of motivate people to take it as a onto themselves, that every person at the moment, every adult person in their population should be vaccinated. So I think let me first dwell on the overcoming vaccine hesitancy. And as with some of the studies which were done more in the affluent countries, the vaccine hesitancy have been 5 C's. And confidence, that is the lack of confidence in terms of the side effects of the vaccine, or as Dr. Jugal was talking about, that a lot of people have this apprehension कि ये vaccine इतनी जल्दी कैसे तैयार हो गई, and so did it go through all the required testing, etc. And so I think to give them a confidence that A, it is effective, and B, it is side effects are much more than counterbalanced, because as they say, any medicine will have a side effect. But that is very minuscule if you look at all the positives and the complacency, convenience. And I think in this regard, the complacency, as again Rajesh Bhushanji's talked about, that even though it's on the wane, but it's not gone.
Right.
I think we let our guards off when the second wave struck us so hard. Partly was because we left the caution to the wings. And I think we thought कि in fact, it was surprising that हम देख रहे थे कि यूएस में दोबारा लॉकडाउन हो गया, यूरोप में हो गया, और हमें ऐसा एहसास हुआ कि नहीं, इंडिया तो हमने अमृत पी लिया है, अब हमारे को नहीं होगा. So I think ये धारणाएं भी जो community radio can actually reach out to them. And I think convenience, because obviously constraints होते हैं vaccination के जो शुरू में ज़्यादा थे, but as public outreach was there, vaccine was available to everyone at several places, whether in government or private. Now 4 or 5 जो category है, risk calculation and collective responsibility, इसके बारे में थोड़ा सा टच अपॉन किया था डॉक्टर यशपाल ने भी, कि एक्चुअली ये वैक्सीन हेजिटेंसी सिर्फ इसके लिए नहीं है. Vaccine hesitancy has been for all. It's a concept which people have talked about. And for COVID, this risk calculation, because it was lesser in the lower and medium income countries for various other diseases जिसमें वैक्सीन मिलती है, because वो देख रहे होते हैं कि because there are so many deaths and so much morbidity occurring because of these diseases. Whereas affluent countries, they have got over most of such इन्फेक्शियस डिजीजेस एक्सेट्रा, तो जिसमें वैक्सीन का इतना इम्पैक्ट होगा। लेकिन कोविड में आई थिंक ये चीज थैंकफुली इतनी ज्यादा नहीं हुई है कि सबको ये एहसास तो है कि हमें जरूरत है। लेकिन यस, कलेक्टिव रिस्पॉन्सिबिलिटी जो एक बार हो गई कि एक जैसे व्हाट्सएप ग्रुप बन गए, ये हो गए वैक्सीन हेजिटेंसी का, तो वो दे ट्राई टू गेट मोर एंड मोर पीपल विद देम कि नहीं वैक्सीन का कोई फायदा नहीं है। दिस हैपेंस मोर सो व्हेन इट्स इन अ क्विसेंट पीरियड, जब इतना ज्यादा कोविड नहीं है। सो आई थिंक वी हैव टू गेट ओवर दैट। एंड सो आई थिंक इन टर्म्स ऑफ what is most important is the confidence, that is to boost confidence in safety and effectiveness of the COVID-19 vaccine. Complacency, you have to combat complacency about the pandemic, because we know that it is far from being over. We would be very happy that if we have seen the last of it, but I think learning from the various experiences of various countries, और या हमारे यहाँ भी जिस तरह second wave आई, in fact हमें जो सब चीजें कोशिश करनी है ताकि अगर एक कहीं पे फिर से दोबारा आती है तो हम उसको कंटेन कर सकें with a proper COVID appropriate behavior and the right steps which can be taken. And of course increase the convenience of getting vaccinated. And I think इस बारे में ये कुछ स्टडीज मैंने कोट किए नीचे। एंड इनफैक्ट कम्युनिटी रेडियो को सबको ये एहसास दिलाना बहुत जरूरी है कि everyone needs the vaccine, irrespective of पहले कोविड हुआ नहीं हुआ, and to protect self and limit severity, help prevent spread to the family, and induce confidence and sense of security at workplace, interacting with friends, vulnerable population. ये बहुत जरूरी है, because काफी लोग जब कहते हैं कि ओ मुझे चिंता नहीं है, मुझे नहीं, अरे भैया सिर्फ आपके लिए नहीं है, you are putting others at risk. आपकी फैमिली को रिस्क आप कर रहे हैं आप, because man cannot man lives in a society. We cannot isolate ourselves. Even if you're isolated, there will be stuff coming from outside, and you will be living with your near and dear ones. You will be interacting with people. आजकल आप देखिए रेस्टोरेंट में भी जाते हैं तो they advertise that our entire staff is vaccinated. आप एयरलाइन में ट्रैवल करते हैं या ट्रेन में ट्रैवल करते हैं, you will be worried अगर आपको पता लगे कि कुछ लोग ऐसे हैं जिन्होंने वैक्सीन नहीं लिए। So I think it is very, very important. And it has to be the community radio can again reach out to the people to say all vaccines are approved only after requisite testing. जैसे वो कहते हैं कि ठीक है हमने जल्दी स्टेप्स किए, बट जिस स्टेप में जिसमें हमें इतनी जल्दबाजी नहीं होती है, शायद आपके पास टाइम होता है टू गो थ्रू वेरियस स्टेप्स, बट इसके अंदर फिर भी कोई भी ऑप्शन अबाउट द सेफ्टी एफिकेसी नहीं छोड़ा गया है। In the world literature, there are instances where have been some steps have been, in the larger interest, have been there have been a shortcut. But इस केस में वो भी नहीं हुआ है, सारे steps किए गए हैं, वैक्सीन प्रॉपरली टेस्ट की गई है एफिकेसी के लिए, सेफ्टी के लिए। एंड ऑल्सो ये जो कई बार जैसे मीडिया ब्लो अप कर देता है, एक जैसे आपने अभी जो डिस्कशन किया, एक कोई कॉम्प्लिकेशन हो गया, ऑब्वियसली जैसे कहते हैं अगर किसी का 0.001% भी है कॉम्प्लिकेशन, तो जिसके लिए हुआ उसके लिए तो 100% हो गया। लेकिन आपको ये देखना है कि फायदा कितना है, नुकसान कितना है। एंड एक्चुअली यू रियलाइज दैट कई बार बैड पब्लिसिटी हैज डन मोर हार्म। जैसे कई बार हम देखते हैं ऑल्टरनेटिव मेडिसिन भी कई बार, आई मीन ऑफ कोर्स देयर आर गुड थिंग्स इन दैट, बट जो फेक प्रैक्टिस कर रहे होते हैं in the namesake of that we are practicing X, Y or even allopathic fake doctors, they would highlight कि अच्छा अरे देखिए इसके अंदर एक ये प्रॉब्लम हो गई ना, एक प्रॉब्लम हुई तो you have to look at that what is the percentage of that, what is the kind of problem which has occurred. जैसे अगर किसी को मान लीजिए थोड़े दिन के लिए nausea vomiting या ऐसी कोई चीज होगी, but overall it's benefiting, so that is much more. So you have to educate the people with the facts. कि इसके अंदर स्ट्रिक्ट मॉनिटरिंग होती है। आपको भी मालूम होगा कि सरकार ने भी पहले एक लिमिटेड सेंटर्स में किए थे टेस्टेड वाटर्स, उसके बाद में उन्होंने अलाउ किया गवर्नमेंट एंड प्राइवेट सेंटर्स के लिए। सो दिस इज वेरी इंपॉर्टेंट, स्टोरेज, ट्रांसपोर्टेशन, एडमिनिस्ट्रेशन एट साइट, एंड एनी एडवर्स रिएक्शन इज गिवन ड्यू सिग्निफिकेंस टू सी कि वो किस वजह से हुआ। सो आई थिंक फील डू दिस स्ट्रेटजी वर्क्स, ताकि उनको सारी आप नॉलेज दीजिए जिससे दे कैन थिंक अबाउट इट, let it sink in to see if they can come to a rational decision, and then you have a behavioral change and they want to get the vaccine and you want to administer that, and government की तरफ से या society की तरफ से we facilitate that. And Sorry. Yeah.
Dr. Agarwal, we're slightly running short of time. If you could quickly.
I mean, I thought that it will set the tone because it contains all the things that we would be.
Yeah, it does, sir. एक सवाल यहाँ पे आता है, quickly we'll come back to you later. ये जो infodemic की बात कर रहे हैं, it's very difficult for us to keep pace with the changing science constantly, और also infodemic जो है malinformation हो, misinformation हो, disinformation हो, तो community radios जब local level पे बात करते हैं, there's lots of changing science, guidelines change हो रही government की, protocol change होते हैं, कल को ivermectin ठीक था, आज नहीं है, पहले हाइड्रोक्लोरोक्विनिन चल रहा था, अब नहीं चल रहा, तो ये कॉन्स्टेंटली ये कम्युनिकेट करना बड़ा मुश्किल काम हो जाता है, तो इसको कैसे क्विकली हम एड्रेस करें?
इसके बारे में मैं ये कहूंगा कि जो आपको उनको कम्युनिकेट करना है जी, अब आपको ये दवा देनी है या नहीं देनी है, जिसको ट्रीट करना है, लेट इट बी लेफ्ट टू द डॉक्टर्स और द हेल्थ केयर वर्कर्स हु आर ट्रीटिंग दैट, राइट सर, उनमें उनको अपना दिमाग लगाने की जरूरत नहीं है। आज की डेट में अगर मेरे को फिजिशियन ट्रीट करता है तो मैं अगर सर्जन हूं तो मैं उससे नहीं पूछता, जैसे डॉक्टर यशपाल बोल रहे थे कि क्या दवा देनी है क्या नहीं देनी है, यू हैव टू काउंटर बैलेंस, देयर आर सो मेनी थिंग्स, राइट। आप उनको पूरा मेडिकल साइंस तो नहीं पढ़ा सकते थोड़े टाइम में, राइट सर, आपको उनको बताना है कि कहाँ पे जाने की जरूरत है, क्या करने की जरूरत है। सही बात सर, जो आपने बोला इंफॉर्मेशन, द राइट इंफॉर्मेशन फ्रॉम द एक्सपर्ट्स, गाइडलाइंस चेंज हुए, जैसे मान लीजिए कि वैक्सीन कितने टाइम का गैप होना चाहिए, ये वो, दीज आर नॉट द काइंड ऑफ व्हिच इज गोइंग टू अफेक्ट, व्हाट वी हैव टू ओवरकम इज कि जनता को जो हमें समझाना है और जो कम्युनिटी रेडियोस का जहाँ पे है, उनको ये समझाना है, कन्विंस करना है कि आप कोविड एप्रोप्रिएट बिहेवियर करते रहें। आज की डेट में ज्यादातर लोगों को मालूम है कि कोविड एप्रोप्रिएट बिहेवियर क्या है। व्हाट इज इम्पोर्टेंट इज टू टेल देम कि आज की डेट में अभी वो समय नहीं आया है कि हम कोविड एप्रोप्रिएट बिहेवियर को छोड़ दें, राइट सर। और वैक्सीन हेजिटेंसी का भी अगेन आपको उनको ये समझाना है कि आप चाहे ये लीजिए, एक वैक्सीन लीजिए, दूसरी लीजिए, तीसरी लीजिए, बट वैक्सीन लेना बहुत जरूरी है, जो टेस्टेड है, राइट सर। सो
I'll just interrupt you here, sir. Thank you very much for this enlightening presentation. I'll come back to you shortly. I'll invite next speaker, Dr. Aleem Arif, हमारे साथ जुड़े हुए हैं, WHO के public health expert है, Dr. Arif.
गुड आफ्टरनून।
एक सेकंड, एक बात सिर्फ मैं कहना चाहूंगा,
जी सर, जरूर,
बाद में मेरे को थोड़ा सा समय और दीजिएगा, प्रेजेंटेशन में कॉर्पोरेट बिहेवियर, सॉरी, कोविड एप्रोप्रिएट बिहेवियर के लिए कुछ अच्छे स्लाइड्स हैं जिसके बारे में मैं पे चर्चा करूंगा।
सर, विल कम बैक सर, क्विकली, सॉरी टू इंटरप्ट यू हियर, डॉक्टर अलीम।
गुड आफ्टरनून, थैंक्स फॉर इनवाइटिंग मी फॉर दिस सेशन। I have a presentation. What do you like to see, the presentation or remarks?
सर जैसे भी आपको बेटर लगे, तो टाइम कम है बस।
नहीं, बिल्कुल ओनली 3 स्लाइड्स है मेजर,
दैट्स फाइन सर।
उसमें से 1-2 स्लाइड्स, मैडम नेक्स्ट प्लीज। Yeah, so this presentation actually is made considering that the experts are already available, communication experts. I need not to delve into those, what messages, how to create that message and radio channels, etc. So I have only analyzed these situations so that these circumstances or the problem should be considered while preparing your programs, radio programs or whatever. So for example, in behavior change communication or IEC, this is too technical a subject, COVID-19. It's very difficult to communicate to the community what is a virus, how it goes to the lungs and why it creates swelling and then breathlessness, then how it spreads, because there is a combination of factors. This may be coughing, sneezing, airborne, touch, fomites, or all of them, the combination of this. This was not very clear, that time. Same is the case with vaccine, as everybody discussed. There were rumors that this vaccine will lead to XYZ. Then we are not sure of the effectiveness of the vaccine, then accessibility, where to go, where to get this vaccine. Then the severity of the disease, there were deaths, but still there were recoveries also. So there were doubts whether this is really fatal or it could be, because people believe that ki hame nahi hoga, so that you can say the feeling. Then the consequences, what are the consequences of the COVID as well as the vaccine side effect, etc. This is related to the behavior change communication. Next, please. Then about the behavior, if you see, this is just the formation of habits or the change of behavior. We are not usually, habitual of wearing mask. We feel suffocated if you see, if you wear the mask, you feel suffocated. And then the quality, we are not sure the quality of mask which we are wearing, or the common man is wearing, a 5 rupees mask, you can imagine the quality. Then washing hands, everybody is saying frequently, but how many times, how long? It should be 20 seconds, but this should be emphasized. There should be prolonged contact. Where? Because in some places their soap and water is not available. Sanitizers, everybody is not carrying with them. So, all these barriers need to be considered. Then I'm not comfortable with the word social distance. Social distance means, you are keeping a boycott, sort of, you are avoiding people. It is more of a physical distance, that there should be a distance of 2 meters between the two individuals, and how to maintain that distance is a big question now. Next, please. So this is my last slide. Again, vaccine, as Dr. Jugal has also spoken, that vaccine, there is hesitancy because of the, this is an extra burden on anyone. A healthy person, is going for an injection, and he has to leave his job, and then there is no guarantee that this vaccine is effective, because people are seeing that vaccinated people are also developing the disease, and there are rumors already, about the vaccine. There is no clarity or usefulness, because people are getting infection after vaccination,
Right.
and there is a news on this. Then accessibility, everybody has already spoken about it. And then which vaccine to take, Covaxin or Covishield. So if one has to travel, he has to take Covishield. So those who have already taken Covaxin, they have to shift it to Covishield. So all these barriers are there in acceptance. Next, please. Then just I want to convey, that I have taken this photo just to show that, the messages should be tailor-made. For tribal areas, the messages should be different, and the community participation, as our secretary also said, it should be developed by participants in the community. Every message should not be conveyed to everyone. Urban areas are different, tribal areas are different, villages are different. Next, please. Then there should not be information overload. If you put the water in a jar, and it will overflow. So there should not be any overloading of the information. Thank you very much. Should be very practical, and thanks for your patient listening.